Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Have you ever paused to ponder why the burden of infertility is often placed solely on women, when in fact, men contribute equally to the issue? Today, we're debunking the myth that infertility is primarily a female concern and shifting the spotlight on male infertility. We'll explore the causes, signs and symptoms, how it's diagnosed, and the available treatments and preventive measures. So, buckle up for an enlightening journey into this less discussed realm. Now that we've piqued your curiosity, let's delve deeper into this less discussed topic. So what could possibly cause infertility in men, you may ask? Well, there are several factors that can contribute to this issue. Medical conditions are a key culprit, with issues like varicocele, a swelling of the veins that drain the testicle. This can prevent normal cooling of the testicle, leading to reduced sperm count and fewer moving sperm. Infections can also interfere with sperm production or sperm health, or can cause scarring that blocks the passage of sperm. Ejaculation issues, tumors, hormone imbalances, and chromosome defects can also lead to male infertility. Beyond medical conditions, environmental factors and lifestyle habits can play a role too. Prolonged bicycling, for example, is thought to increase testicle temperature and cause reduced sperm production. Exposure to heavy metals and radiation can also affect fertility. Certain medications can also impact sperm production. It's a complex issue with many potential causes. Understanding the causes is the first step. Now let's look at how to identify the signs and symptoms. How does one know if they might be dealing with male infertility? Well, recognizing the signs and symptoms is the first step. However, the tricky part is that many men may not notice any obvious signs until they try to conceive a child. Now, let's talk about the common symptoms. They include problems with sexual function, such as difficulty with ejaculation or small volumes of fluid ejaculated, reduced sexual desire, or difficulty maintaining an erection. There can also be pain, discomfort, or swelling in the testicle area, and recurrent respiratory infections that seem out of the ordinary. And then there are subtle changes, like decreased facial or body hair. These symptoms might indicate hormonal problems or other underlying conditions that could lead to infertility. And while these signs don't necessarily mean you're infertile, they're worth discussing with a healthcare provider. Awareness of these signs and symptoms is crucial. Next, let's discuss how male infertility is diagnosed. So how does one confirm if they are indeed dealing with male infertility? The diagnosis process can involve numerous methods. One of the most common is a semen analysis, which evaluates the health and viability of sperm. Then there's hormone testing. Hormones play a crucial role in sperm production and sexual development. Abnormal hormone levels can be a telltale sign of fertility issues. Genetic testing is another critical method. It can reveal any genetic defects that might be causing infertility. In some cases, a testicular biopsy might be necessary. This procedure involves removing a small sample of tissue from the testes for microscopic examination. Imaging tests like ultrasounds can help doctors visualize the reproductive organs and detect any abnormalities. Specialty tests such as post-ejaculation urinalysis or transrectal ultrasound may also be used to provide a more detailed and comprehensive picture of the situation. Diagnosis is just the beginning. Now, let's discuss the treatments available for male infertility. So, what can one do if diagnosed with male infertility? First, it's important to remember that a diagnosis is not a dead end. There are several treatment options available, and the best one for you will depend on the underlying cause of the infertility. For some, surgery can correct issues such as blocked vas deferens, the tube that carries sperm. Medications can also play a role, especially when the problem is related to hormonal imbalances. And then there's assisted reproductive technology, or ART. This includes procedures like in vitro fertilization, where sperm and egg are combined in a lab, then implanted into the uterus, or intracytoplasmic sperm injection, where a single sperm is injected directly into an egg. But what about prevention? Well, while not all causes of male infertility can be prevented, there are steps you can take to optimize your overall reproductive health. Living a healthy lifestyle is key. This includes maintaining a balanced diet, exercising regularly, and keeping stress levels in check. Regular checkups with your healthcare provider can also help detect potential issues early. Avoiding risk factors is another crucial step. This means limiting alcohol, quitting smoking, and staying away from illicit substances. It also includes protecting yourself from sexually transmitted infections, which can affect fertility. Remember, knowledge is power. Understanding male infertility can help break the stigma and open paths to solutions. Let's wrap up what we've learned today about male infertility. It's a complex issue, often caused by underlying health conditions, lifestyle choices, or genetic factors. Signs may range from sexual performance issues to hormonal imbalances. Diagnosing it requires medical tests, but remember, it's nothing to be ashamed of. Treatment options are diverse, from medication to surgery, even lifestyle adjustments. Prevention: maintain a healthy lifestyle, get regular checkups. Remember, infertility is not a woman's problem. It's a human issue that requires understanding, compassion, and open conversation. UMCC, your ultimate medical consultant connectors.